Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Tuesday, October the 5th. We are honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. We have quite a bit of information to report today, and we'll be providing plenty of time for questions. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. Today I'm going to provide our latest updates on the COVID-19 public health response, including some of the updates around vaccination and vaccination issues, as well as the public health community response. As I don't need to say to people, we are heading into respiratory season, which means we need to ensure we have all of those pieces in place to put us in the best position possible to get through this next few months. This means ensuring we are all fully vaccinated, both for COVID and for influenza, and we make sure that we're taking the appropriate precautions as we all start to spend more time with loved ones and friends and family indoors. I also want to start today by acknowledging with thanks to all of the members of the legislature sitting again this week for setting the example of being vaccinated to safely return to work. And I am very grateful for all of you for working together and for supporting all of us across the province in making sure that that you are setting the example for people in British Columbia. To start with the vaccine update, today we are expanding the availability of a third dose to a second group of immunocompromised, clinically extremely vulnerable people. This is there's a number of people, as we know, who are in that group who were prioritized to receive vaccines early, and there are a number in that group whose immune systems do not respond as well to vaccines. And we now know that adding a third dose can actually stimulate a response for many people that gives them as much protection, or at least some protection, closer to what people with a strong immune response system have. So today we're expanding to approximately 100,000 people, individuals in British Columbia who will receive an invitation for their third dose. And these are people who are moderately to severely immunocompromised. So in addition to the groups that we talked about 15,000 people about 2 weeks ago, we are now adding people who are on active treatment for solid tumor or hematologic malignancies, so those are blood tumors, since March 2020, who have received or are receiving systemic therapy. So that includes chemotherapy, molecular therapy, immunotherapy, targeted therapies, including CAR-T, monoclonal antibodies, hormonal therapy for cancer, and people who have both solid tumors as well as hematologic cancers, and people who since October 2020 have received or are receiving radiation therapy for cancer. So I know this is a broad group of people, and we have been working under the guidance of Dr. Ballum and Dr. Maureen O'Donnell at PHSA to make sure that we've been in contact with all of your specialists who have identified the people who are receiving these types of therapies, and you'll receive an invite from us in the next few days. In addition, people who have moderate to severe primary immunodeficiencies. These are diseases that we often develop or are born with. So these are combined immune deficiencies affecting T cell, immune dysregulation, particularly things like familial hematophagocystic lymphohistiocytosis. Those of you who have that know what that is. Or those with type 1 interferon defects caused by a number of genetic primary immunodeficiencies, etc. Again, we have been in touch with the specialists who most of you will be seeing to identify you. And in addition, people who have moderate to severe primary immunodeficiency, which has been diagnosed by an immunologist and requires ongoing immunoglobulin replacement therapy, so IVIG or SCIG, or the primary immunodeficiency has a confirmed genetic cause. And these are also more rare diseases like DiGeorge syndrome or Wiskott-Aldrich syndrome. In addition, people who have AIDS-defining illness or CD4 count less than 200 or CD fraction less than 15%, or a detectable plasma viral load since January 2021, or HIV infection and are people who are 65 years of age or older, or perinatally acquired HIV infection. Again, a small group of people that we are connecting to reach out to your care providers and to make sure that you have the opportunity to receive a third dose. There are also number of biologic agents that can affect our immune system's ability to respond to vaccines. And these are often used to treat people who have autoimmune disorders. And we know there's a lot of confusion that I hear about people with certain autoimmune disorders, whether they can receive a vaccine or not. And to you, I say, absolutely. If you have multiple sclerosis, if you have rheumatoid arthritis, if you have lupus and many other illnesses for which some of these medications are prescribed, you are at higher risk of having severe illness or complications from COVID, and we have seen that across the board. So not only should you be immunized, you are now eligible as well to receive a third dose to make sure that you have a good, strong immune response. So there are a number of biologic agents, and I won't list them all. These will be available on the BC CDC website, on the Immunize BC website, so people can go and find out which ones they are. And in addition, we'll be adding people who since December 15th, 2020 have been treated with oral immune suppressing drugs. Again, drugs like azathioprine and others. And again, those will be listed. And people since December 15th who have been treated with immune suppressing infusions or injections of things like cyclophosphamide and others. Finally, another group of people who we know don't always mount a good, strong immune response are people who are on dialysis or have severe kidney or renal disease. And again, we have been in contact with your care providers around the province, and we have information on who you are, and you will also be receiving an invite to receive a third dose as part of your primary series. So you will be contacted by the provincial Get Vaccinated system about how and when to book your third dose. And if you believe you meet one of these criteria, and the details will be on the website, and have not been contacted by next week, you can get in touch with your healthcare provider, and we're providing through Doctors of BC and the college an attestation letter that will ensure that you can get your third dose if needed as well. As I shared a couple of weeks ago, people who are much greater at risk of severe illness, and in these two groups, may not have had sufficient immune response to 2 doses. This will bring these people up to the level that the majority of us who have 2 doses have. And so that is an important indication of a way to protect people who are most at risk for severe illness. I know that many people have been asking about third doses for people who are fully vaccinated, yet their vaccines or the combination of their vaccines are not recognized in some countries around the world. All of Canada's vaccines are highly effective in every combination that we have, and I presented data last week that showed that here in BC, and we have similar data from other provinces in British across the country. For those who have taken AstraZeneca, who've taken the vaccine that was offered to you at the first opportunity, you did the right thing. And I thank you for doing that. It has made a tremendous difference in transmission of virus and in protecting both yourself, your family, and your community. And your efforts have helped to reduce the spread of this virus in BC, and the data that we presented last week show that these combinations work and work well. We are now actively working with Health Canada and will continue to work with the Public Health Agency of Canada to make sure that Canada has a single internationally recognized vaccine passport that includes the recognition of these combinations. And I can tell you, my colleagues at the Public Health Agency and Dr. Tam have been meeting with our counterparts in other countries, particularly the US CDC, and I know there's a lot of concern about travel to the US. Right now, there are no vaccine restrictions in traveling to the U.S. by air, and we know they will be updating the requirements in the coming weeks as we get closer to hopefully the land border opening. And we are working very closely with counterparts in the U.S. Centers for Disease Control to make sure that these highly effective combinations are recognized. So please be patient. I will also tell you that we've been working with colleagues in the UK, the European Union, and a number of the important sun destinations that many Canadians go to, including Mexico and the Caribbean, where mixed doses have been a part of the immunization program in many countries, in 19 of the EU countries, for example, and the UK. And these combinations are being recognized by many countries and will continue to do so as the data that we have here in Canada and in other countries shows how effective they are. So please be patient. This is changing rapidly, and we know that we will have updates on this in the coming weeks. I will also say that the WHO has been reviewing data on mixed and max combinations because it is important for the global pandemic response as well. And as part of that, I want to report that BC will be returning 300,000 doses of mostly Moderna vaccine to the federal government, to our procurer. These vaccines are not required at this time right now in BC, and we still have a large number of vaccines that are available to meet our needs over the next few months. And these vaccines will be part of the Canadian donation to the COVAX initiative. It is incredibly important for all of us in BC and in Canada that people around the world are vaccinated and protected against this virus. That is the only way that we will get out of this global pandemic, and it's important that we do our part to support that as well. We can be proud that we are doing that here in BC. In terms of our ongoing pandemic management, as I have indicated a number of weeks ago, we have an order coming out around requirements for vaccination for all workers in long-term care and assisted living. And I'd like to provide an update on that here today. That order comes into effect next Tuesday, October 13th. And the order in its details will be published on our website today. And there has been some modifications of it that are important. People hired between October 12th and 26th must have a single dose of vaccine and be at least 7 days post that dose and follow additional preventive measures, and must get their second dose within 28 to 35 days after that first dose. So people who receive their first dose prior to next Tuesday will be able to continue to work following these preventive measures, but they must commit and receive their second dose by 35 days after their first dose. This is recognizing that it is important for us to have people who are vaccinated working in these high-risk settings, and we encourage every single person in long-term care. We know the vaccination rates are high, but in some places they are not yet high enough. It is not too late to protect yourself, to protect your family, to protect those we care for, and the workers that we work with. People who are ineligible to work after October 12th because they have not yet received at least one dose will be off work as of that day without pay. If you do then decide to get your first dose, it will be 7 days before you're able to return to work with additional precautions in place. And you must again receive that second dose within 35 days after the first. Anybody hired after October 25th will need to be fully vaccinated to work in any long-term care or assisted living facility. In the orders you will see as well that we have made allowance only for medical exemptions. If you're waiting for a medical exemption decision, and it does take some time sometimes, we have a central process for doing that, then you must follow additional preventive measures as prescribed. So the forms that are required to request an official medical exemption are available on the website as well, and we have put out information to physicians and nurse practitioners around the province about what constitutes a valid medical exemption, and we've been working very closely with immunologists and allergists and our experts in vaccines at the BC Centre for Disease Control to make sure that we have all of the information that you need. So you must have a valid medical contraindication, and those are very few. The requirements, again, that outside healthcare outside healthcare providers, personal and other providers, must follow, which are in our vaccination status, are now in this order as well, which means that people who want to volunteer or work for personal settings, things like hairdressers or people who take care of podiatry, for example, in a long-term care home, you must be vaccinated to work in any long-term care home in the province. To support this requirement for vaccination for anyone working or volunteering in a healthcare setting, we are also updating our visitor policy for long-term care and all other healthcare settings. This supports and protects our healthcare workers and the people receiving care and living in these higher risk settings. Starting October 12th, visitors to long-term care and assisted living will need to show their vaccine card for proof of full immunization. And starting October 26th, in line with the orders around healthcare workers in acute care and community care settings, to visit in acute care settings, you must also show that you're fully vaccinated. Those who are not fully vaccinated will not be able to visit in healthcare settings as we go into this time of increased respiratory illness and challenges, as well as we know, COVID virus. We will, of course, have exceptions for certain situations like palliative and end-of-life care. This coming weekend is Thanksgiving, when many of us typically gather with family and friends over a meal. And I want to ask everyone, please keep your group small this year. Remember what we are seeing in our communities right now. And in particular, if you have older family members or anyone who is immune compromised is planning to attend, make sure everybody who is there is fully vaccinated. That's what you can do to protect yourself, then to protect those you are closest to. We want to make sure these gatherings are a happy occurrence and not a cause for virus transmission and illness in the coming weeks. We've learned that this virus, especially the strain that we're seeing causing illness here in BC right now and across Canada, the Delta strain, not only is way more transmissible, but it is causing more severe illness in younger people. And we see that every day in our ICUs here now, in our hospitals, in the number of people who have severe illness, and sadly, in the number of deaths that we're seeing. Vaccination protects you from this serious illness. We are seeing very good protection, continued very strong protection against severe illness from anybody who's been immunized. So it is not just altruistic, it's not just to protect our family and our friends, but it protects you, even younger people who might have done quite well with if they had been infected with the virus that was circulating even a few months to a year ago. This strain is causing more severe illness, and our best tool to protect ourselves is to be vaccinated. I know in addition to our healthcare settings, many other organizations are also taking steps to put vaccine requirements in place for workers in their settings. It's about keeping your employees, your business partners, and your customers safe. And I would like to thank, as I did already, every member of the Legislative Assembly for committing to be fully vaccinated and doing your part. You are leading by example. And today, the BC Public Service has also announced a requirement for vaccination for everybody who's working in the BC Public Service. And I'm very proud of that recommendation as well, as we need to be showing the way and setting an example in our province here in the BC Public Service. I commend these efforts and encourage businesses to also consider this well-considered approach. Thank you very much, and I look forward to taking your questions.
Thank you very much, Dr. Henry, and I'm going to take you through just a few items of information today about the COVID-19 pandemic. There'll be a vaccine update, the proof of vaccine requirement in BC's public service, vaccination among long-term care and assisted living staff, contact tracing efforts, and ICU capacity and overall capacity in our hospitals, and our surgical renewal commitment. With respect to vaccinations, and this was as of Sunday night, more than 4,087,000 British Columbians have now received their first dose of a COVID-19 vaccine. That's 88.2% of eligible people 12 and over in BC, which is an achievement of the people of BC and of our extraordinary healthcare teams. 81.6% are fully vaccinated. You'll see that the gap between those who are partially vaccinated and fully vaccinated is closing. It's now 6.6%, meaning they've received 2 doses of a COVID-19 vaccine. Over 18 amongst adults, those numbers are 88.7% of eligible people 18 plus with their first dose, 82.3% their second dose. And everyone involved has decided to make themselves, their family, their community safer. Many employers have been seeking sound advice and guidance on vaccination policies applicable to their situation. These employer actions are welcome news to us all, and they are to be encouraged. As announced earlier today by the BC Public Service Agency, government is acting to increase workplace confidence across the BC Public Service and to stop the spread by requiring proof of vaccination. The BC Public Service is held to the highest example and is there to serve the people of BC. And this important step reflects that duty. It's of the utmost importance that all of us, government, business, and individuals, show leadership on vaccination to make sure everyone in British Columbia is safer from COVID-19. This step by the public service shows the dedication and commitment to support the provincial effort to protect people and get through the pandemic together. We strongly encourage everyone in the province who is not fully vaccinated to make the decision to do this today. Whether it's business or government, acting to make everyone in the province safer from COVID-19 is the right step for everybody. To those who are eligible to be vaccinated, but who have not made the decision to do so, I say this. What matters in our BC pandemic today is what we do right now. What matters, it's not what we did a year ago. It's not what we've done over the last 6 months. It's right now, this moment. And what matters right now is that each of us makes it through, that we make it through safely, that we make it through healthy, that we make it through, that you make it through. And offering yourself unprotected to COVID-19, presenting yourself unvaccinated to the brutally and assuredly transmissible Delta variant when there's an alternative is no way to make it through. There will be many legacies arising from our BC pandemic. Some, as we've seen, are positive, restorative, and affirmative. Let not be your legacy be one of, I should have, I wish I had, if only I had. That is no legacy, not for you, not for your family, not for your friends. Please make the better decision. To those who are eligible to be vaccinated and have not decided to make this essential life and health-saving decision, I implore you to look around you, to see the loss and the regrets that others who thought they could face COVID-19 unvaccinated have expressed for trying to face this foe unarmed, unsupported, and so needlessly vulnerable, and make a better decision. Choose your health, choose your loved ones, choose safety, and get vaccinated. With respect to the vaccination of staff in long-term care facilities, I wanted to bring you up to date on where we are. Dr. Henry talked about the order that will be published today. With respect to this, we know that this order is coming into effect end of day, October the 12th. That's next Tuesday. And I want to give you a sense of the numbers of who's vaccinated and what percentage people are vaccinated in different health authorities. Every health, long-term care and assisted living facilities has or will be putting a plan in place to address the potential health human resources challenges involved. We have some facilities that have not provided the information yet, but they are doing so in many cases today and have done as we speak, and we'll have full information to provide you shortly. In the Fraser Health Authority, 97% of healthcare workers in long-term care and assisted living have received a first dose, and 93% have received a second. In the Interior Health Authority, 93% have received a first dose, 88% received a second. In Vancouver Coastal Health, 97% have received a first dose, and 94% have received a second. On Vancouver Island, 95% have received a first dose, and 91% have received a second. And in Northern Health, 88% have received a first dose, and 79% have received a second. That's for long-term care. For assisted living, in Fraser, it's 96% first dose, 94% second. In Interior, 95% first dose, 90% second. In Vancouver Coastal, 99% have received a first dose and 96% a second. In Vancouver Island, 97% have received a first dose, 94% a second. And in Northern Health, 93% have received a first dose and 87% have received a second. We'll be sharing more data on this later this week when the data is finalized, but that tells you where we are. Those percentages represent about 46,000 healthcare workers. And I want to note to everybody, and Dr. Henry has been clear about this, that this group of people, the group of people we're talking about, has done extraordinary work in this pandemic. Their generosity, their commitment, their dedication is something that we are all honored and proud of. And this is another step in that journey. It's a provincial health order to get vaccinated. And so if there are people who are currently unvaccinated, at the end of day, on October 12th, they will be going on leave of absence without pay. And as Dr. Henry has said, there will only be medical exemptions from that. And so now is the time to get vaccinated, to not have that happen, but as well to support the efforts that are so important in long-term care to ensure that everyone is protected. I'm so proud of our workers in long-term care. I'm very proud of these levels of vaccination, which shows the commitment of people in long-term care to the safety of residents and the safety of the community. And we have the opportunity in the coming days to do even better. And I encourage everybody to do so. As I reported last week, as COVID-19 cases declined over the summer, we went at the height of the second wave to more than 10,000 active cases. We went down to under 1,000 for a period, and now we're back at around 6,000 cases. Health authorities redeployed some contact tracers to support vaccination or other public health efforts, while others returned to their base positions, including acute care and others other areas that needed support in the healthcare system. In the weeks since, health authorities have refined their initial data on individuals who have returned to contact tracing positions and have added additional staff, bringing to 1,396 the number of contact tracers in place across the 5 regional health authorities and the Provincial Health Services Authority as of October the 4th. That's 504 in Fraser Health, 195 in Interior Health, 152 in Northern Health, 188 in Vancouver Coastal Health, 119 in Vancouver Island Health, and 238 in the Provincial Health Services Authority. Each of these health authorities continues to add additional contact tracers, and I will continue to report on that progress in the coming weeks. I want to briefly speak to issues around ICU and hospital capacity today. As you're aware from previous briefings, we have 9,218 base beds in our healthcare system and a further 2,353 surge beds across the healthcare system. And today, base bed occupancy rate is 94.3%. Surge bed occupancy rate is 15.3%. So to put that in context, in terms of our overall health system capacity, as of today, 9,052 people are in hospital overall in BC. That number on September 3rd, a month ago, was 9,088. So it seems like a calm and stable situation in the sense that it's a similar number. It's slightly declined in overall hospitalizations. But this is because of the measures that we've had to take together to support one another in this pandemic. The decision I'll be reporting on later to delay certain surgeries, for example. So the situation is being managed, but it is not in a good way when you have to make the kinds of decisions we've had to make. As you'll know, as I reported yesterday, 32 people in ICU in the Northern Health Authority have been transferred to the Vancouver Island Health Authority, Fraser Health, or Vancouver Coastal Health. 26 of them are COVID patients in critical care, and none of those 26 is fully vaccinated. That's the reality of the situation. And so all of these steps are being taken to ensure that our acute care system can respond appropriately to all of the things it needs to respond to. That's the overall question. In critical care, as you know, there's 510 base critical care beds in our province, which is a significant number of beds. Of course, there are 218 surge beds for a total of 728 critical care beds in our province. And just to put that in context, today we have approximately 467 people in total. That's not with COVID-19, in total in critical care. And that is a significant number, and it's not too dissimilar to the number that were in critical care on September 3rd, which was 446. But, of course, a very significant number of those, and we'll be announcing them later, are in critical care with COVID-19, and 120 of those are unvaccinated in critical care with COVID-19, a position and a situation of high risk. It is obviously not desirable to be deferring surgeries and other procedures in our healthcare system to deal with the situation. And the message in these numbers, which have been consistent, is that we will continue using the plans that we've made public and in September 2020 to continue to manage our healthcare system to ensure care can be provided for everybody. But the one thing we can all do, the one thing we can do to help in our healthcare system is to get vaccinated, and to get vaccinated today. Last week I reported that pressures from COVID-19 had caused additional postponement of non-urgent scheduled surgeries in several health authorities. And a number of hospitals continue to postpone surgeries. That means from September 26th to October 2nd, the health authorities postponed 241 non-urgent scheduled surgeries. That was 16 in Fraser Health, 56 in Interior Health, 1 in Northern Health, 11 in Vancouver Coastal Health, and 157 in Vancouver Island Health. From September 5th to October 2nd, cumulatively, there have been 1,384 surgical postponements. That said, surgeries are continuing. You'll see the dramatic difference in these numbers compared to the suspension of non-urgent scheduled surgeries in the first wave of the pandemic. So from September 12th to September 18th, health authorities completed, with all of this going on, 6,530 surgeries, which is, I think, an extraordinary effort by everyone in the health system. Last week, I reiterated our commitment to every patient who have had their surgeries delayed, that they will soon receive a phone call to reschedule their surgeries. Every one of these surgeries is important, and we all need to do our part. Just to report on some of the details, in Interior Health, Royal Inland Hospital will resume non-urgent scheduled surgeries this week, meaning that Royal Inland, Kelowna General, Penticton Regional, and Vernon Jubilee hospitals are resuming non-urgent surgeries. In Fraser Health, also this week, Surrey Memorial Hospital will resume non-urgent surgeries in a second operating room, fully restoring all surgeries at that hospital. As we've said throughout the pandemic, the people we're relying on to deliver surgeries are in equal and greater measure counting on us, on all of us, to stop the spread so they can do their critical work. And so I wanted to say, finally, my continuing appreciation to everybody working in our public healthcare system and to everyone in BC. We are making progress, and we need to keep building on the momentum of vaccination in our province. The community that's seen the largest increase in the last month, in the month of September, was Fort St. John, the largest percentage increase in its vaccination rate. And I applaud those efforts, and obviously at 72% we want them to continue. But those have been significant efforts. We are making progress, and we can continue to do so. But it is important, it is critical, it is essential to get vaccinated now. And I encourage everyone in British Columbia, again, to do so. And with that, we're happy to take your questions.
Thank you. A reminder to reporters on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. For the first question, we go to Vaughn Palmer, Vancouver Sun.
Good afternoon. Thank you for the briefing. Emphasizing again today in the information we're being given of the problem in northern and northeastern British Columbia. BC Hydro reported last week it's had 2 major outbreaks at Site C this year, and the majority of the cases were among the unvaccinated. Hydro also says that a significant share of its workforce rotates in and out of British Columbia from Alberta. Should Hydro be making it mandatory to be double vaccinated to work at Site C as a way of helping contain the problem in northeastern BC?
The short answer from my perspective as provincial health officer is absolutely yes. We have been working with my teams in Northern Health, the public health teams. Dr. Jung and Jung Kim and our team have been working with Site C all along. We had some challenges with a number of the large industrial camps over last winter and put in measures and worked with them. They have very strong medical support on site now and have had for the last year. But yes, these continue, and it started in the summer. We've had reports from Northern Health. We've put in additional orders for the industrial camps that require reporting of vaccination status of workers, but it's not high enough, and that is contributing to some of the surge that we're seeing in communities. It's also contributing to challenges in workers becoming sick, particularly in the congregate living settings that they're in the industrial camps. So I have written a letter to all of the employers in the large industrial camps, particularly in the north, saying that it is my very strong recommendation that they make it a requirement, particularly of living in the communal living settings that they have in the industrial camps.
Yeah, just to add on, because the detailed information gives a sense of that, there was an outbreak declared on August 18, 2021 at Site C. There are currently 15 active cases at that outbreak. The situation is stable. Just so we understand, 3,575 doses have been administered on site. That's 1,985 first doses and 1,590 second doses. The immunization rates of the workers, of the 2,000 workers reporting to date, is 83% fully vaccinated, 7% partially vaccinated, 5% unvaccinated, and 5% not disclosed. We've been making progress there. And as of October 1st, there are 1,687 workers in camp. The short answer is we're encouraging everyone to go this route. It's important. And obviously, Crown corporations are not the public service, as you'll understand, but we're encouraging everyone in BC to get vaccinated and encouraging our leaders in BC, whether in whatever part of the business sector, public or private, to encourage these efforts as well.
Vaughn, do you have a follow-up?
Yes, please. You've said several times that employers have a right to make vaccination a requirement to work. Where employers have not done that, how much leeway do employees have to refuse to work alongside the unvaccinated?
Yeah, I'm not sure I'm qualified as to answer those questions, I'm afraid. Those are part of labor relations and labor laws. I know there is good advice that WorkSafe BC has put up that the Ministry of Labour has pulled together for employers to answer those specific questions. But it is an important consideration. You do have a requirement to have a safe workplace. And what we're seeing right now with the strain of the virus that's circulating is it can be transmitted very rapidly. And that risk goes down dramatically when everybody in that setting is vaccinated. So it is an important worker safety issue. But for the technical advice on how that plays out within an individual workplace, I refer people to WorkSafe BC. They have some great information there for employers.
For the next question, we go to Richard Zussman, Global News.
Dr. Henry, you've obviously mentioned that the public service is now required to be vaccinated starting in November. Many of those workers work in controlled environments, workplaces. We anticipate they already have a high rate of immunization within that environment. In a school setting, teachers are mainly working with those who are not immunized in the elementary system all the way up until 12. Why not send out a provincial purview to require immunization for schools? And if not that, what is your expectation? Are you concerned that some districts with lower rates of immunization will not do it themselves because it would mean there would be far too many in the system not immunized or not being able to work because of the mandate?
Yeah, that's a very good question. And these are obviously things that we've been talking through and thinking through quite a lot. And so as I've said several times, public health orders require certain conditions to be in place. I have to have reasonable and probable grounds to believe there's a health hazard. And there is that in a healthcare setting. And that's why we've focused on the areas where an order is needed in a healthcare setting. So it is a different situation in many other settings, including industrial camps, including absolutely schools. So we have been talking with the Ministry of Education, with union representatives, with our committee that we have, our school committee, and I know that the Minister of Education is looking at how to do this, or how these issues can be addressed in an inclusive provincial perspective. And I don't know, Minister, if you wanted to talk to that, because I know there's been some ongoing discussions.
Thank you very much for the question, Richard. As Dr. Henry has said, the vaccine mandates by public health order are healthcare, and they relate to healthcare. And of course, there are hundreds of people in the hundreds of thousands working in healthcare, including 50,000 who will see that order put in place on October 12th. We know there is a desire expressed by people in school communities for mandates in education, and as such, the Education Ministry, my colleague, Minister of Education Jennifer Whiteside, is immediately convening an advisory committee, an ad hoc one with BCPC and other partners to develop common principles, standards, and guidelines to support boards with the potential implementation of vaccine mandates. The committee will work quickly to get these materials to boards as soon as possible. If boards wish to explore a vaccine policy independently, we would strongly encourage them to work with BCPC and their local partners. In other words, that work is going on. In the direct public service, the direct employees of the public service agency, and this is a direction from the Deputy Minister, the head of the public service, Laurie Wanamaker. This has been put in place where we are direct employers, and we put this measure in place. I think it's an important measure to make people safe, and we're encouraging everybody in every possible way to get vaccinated.
Richard, do you have a follow-up?
I do. You provided, obviously, the numbers today on long-term care staff that are immunized. Do we have any sense about what that is like for the larger healthcare system? Are we worried about how many workers may not be able to work come October 26th in that case? And I know you've made a bunch of changes today. Was that to try to avoid losing a number of workers on October 14th in long-term care and assisted living?
It really was an evolution of the intent of the orders, and the intent of the orders is, of course, to provide the best protection through vaccination that we can, both for workers themselves, so that we can keep the care system going, but also for those we care for who are more vulnerable to severe illness. So we don't want to penalize somebody if they've made that correct decision, the best decision to be vaccinated. So it is putting in place the provisions that are supporting people, that it's not too late to get vaccinated and to be able to continue to work with additional precautions and testing, etc., in place. And if we look at the broader healthcare sector, those orders are under development. There's a consultation process that we do with HEABC, with the unions, with the health authorities, etc., the colleges of physicians and nurses and pharmacists and others who are affected. So those are in their final stages as well, and will be coming out in the next few days and be posted so people can see the details there. But really, it is we don't have the same degree of information, but we have some good, strong numbers from some of the areas in the broader health sector, and we expect that we're going to see very strong, positive numbers similar to what we're seeing for long-term care. So yes, it is supporting people, cajoling people, ensuring that they have all of the information that they need to make that right decision as we head towards both the 12th and the 26th.
For the next question, we go to Mike Hager, Globe and Mail.
I just want to follow up on that staffing concern. Can you just further explain why the deadline was extended for the second dose? Is that a real concern in long-term care and assisted living, given workers are hard to come by in the best of times?
Well, it's always supporting, and we haven't extended the deadline. The deadline is still the 12th, but what we've done is made sure that people are not penalized if they've had their first dose and are committed to getting their second dose, and so that will be official. And it really puts it in line with what we were doing for new hires and other. So, but yes, it is because we know that we have a very limited healthcare resource, that we are supporting people to get immunized, to make sure that they continue to provide the care that they've done so well through this last year and a half. And yes, it's to make sure that every facility, every resident is still able to get the care they need. And we've been putting in contingency plans to make sure that that will continue. So it has been a huge endeavor, and I can't say how appreciative I am. I can't say enough how appreciative I am of all of the healthcare workers in long-term care and acute care who've been supporting each other as we've worked through all of the issues that people have on this really important issue. But it is the most important thing that we can do to protect residents, to protect patients, to protect each other as we head into this respiratory season. Don't know if you want to add more?
And just to be clear, I mean, 96% first dose immunization is very good. We've seen in the last number of weeks in the hundreds of new healthcare workers in long-term care and assisted living get vaccinated, and that's really important when you consider the relatively small number of people, the 4% who are currently unvaccinated. And so what this change does, is it says to everyone who is unvaccinated in long-term, working in long-term care assisted living this week, that they can get vaccinated and continue to work with the provisions put in place by Dr. Henry following October the 12th. So the deadline is the deadline to get vaccinated. That will continue to be the case, and I'm very encouraged as we do work facility by facility that we can continue to move those numbers up, because there's something that's better than 96%, it's 97% and 98% and 99%, and that's where we want to continue to push over the next week.
Mike, do you have a follow-up?
Oh, thank you. The Minister of Health referenced, more numbers coming out later this week. Can you just give us a sense of the percentage of broader healthcare workers that are fully vaccinated, and just how the resourcing will be, the resources will be reallocated once that other deadline hits, and if there are shortages?
I can't give you those numbers in exactly right now. That's the work that's ongoing in the health authorities. We know, for example, that at least 97% of physicians in the province, from Doctors of BC who've been talking to physicians, are immunized, and we know that continues, and it continues facility by facility through the health authorities in particular, but in many of the community-based organizations as well. And I think that's important. The orders for acute care and community care are very inclusive. It is anybody who is an employee of a health authority or a contracted facility. So it essentially includes healthcare workers who work in settings outside of a hospital, outside of a community center. So if you're a healthcare worker from PHSA, for example, who works in the correctional facility, it will cover you. So I think people have been waiting to look at what the scope is, and I've been very clear from the beginning that includes all healthcare workers in all of the settings in the community and in facilities across the province. And I believe that will be an incentive to get that up. But we have a system that records employee immunization, and so the health authorities are working on that right now to try and determine how many people are vaccinated in different programs. So I don't have those numbers right now, and I don't know, Minister, if you do at the moment.
But I just say, like that, the 96% number is based on 46,000 people. They're actuals. It's not a survey. It's not anything else. It's actuals. And I think that would be reflective of the broader system, and we'll be reporting on the numbers through acute care and in the community in the coming weeks. We're obviously focused in the next number of days to ensure that we get the complete picture, and we work with individual facilities because, as you know, at 96% there are facilities that are above that and inevitably facilities that are below. And so we'll be doing a lot of work in the next few weeks to raise those numbers everywhere and in every community across BC. Just to say, though, that 96% of this very large group of healthcare workers across the spectrum of healthcare in long-term care and assisted living is a pretty good indication of where we sit in healthcare. We're at 88%, we're at about 89% of all adults, then that puts us at 96% above that, and you see it across the regions where healthcare workers are significantly above the regional average in every region in the province as well. So I think this sample of 46,000 workers is a pretty good indication.
For the next question, we go to Rob Buffum, CTV Vancouver Island.
Oh, hi. Thanks for taking my question. My first question is the First Nations Health Authority is calling for booster shots for members of First Nations, particularly perhaps after a recent outbreak amongst the Hausut First Nation. I'm wondering what's your reaction to that, and what is the likelihood that we will see First Nations communities prioritized for a booster shot?
Yeah, so the FNHA and we're working very closely on this whole issue. There's a number of things around booster shots, and we've made the first decision based on the advice from the National Advisory Committee on Immunization, looking at timing, et cetera, around residents of long-term care. But we are also looking at what other populations should be prioritized for a booster shot, who's it needed in, what are the parameters that we're going to use, and why would we do it. So there's a couple of things that we're looking at. One is people who were immunized earliest and with shorter intervals. Things we've learned are that the longer interval gives you stronger and longer lasting protection, which is good news for most people in BC, but there's some communities that receive their vaccine at the shorter interval. So those are all things that we're working through, and we're working through the data on whether it's needed. I will say that there are a number of First Nations communities across BC right now, particularly in the north, but also in all of the areas, the health authorities, where we prioritize vaccination, and we had really good uptake, particularly in seniors and elders. And it made a huge difference in blunting our second and our third waves. But we are now seeing that leveled off. So the number one priority for all of us in communities. I've had the privilege of speaking with First Nations leaders across the province a couple of times, and again I will this afternoon. The First Nations Health Authority is to get everybody vaccinated. So we still have rates that are below the average in the province in a number of communities, and we're seeing transmission, leading to severe illness in people who are not vaccinated, leading to hospitalizations, and sadly we've seen some deaths. So the most important thing that we are all working on right now is getting everybody with their 2 doses. And yes, we are looking at whether booster dose is needed across the board, not only for Indigenous peoples here in BC, but across Canada. So we're sharing data with our counterparts with the Indigenous Services Canada. So all of these things are under consideration. In some communities where we are seeing a lot of transmission and breakthrough infections as an outbreak management tool, like we do in long-term care, there may be an occasion to offer a 3rd dose in those communities. But those are all things that we're doing, working with leaders and health leaders on the ground for each community. So we'll have more to say about that in the next 2 to 3 weeks, not only about Indigenous peoples and First Nations communities, but also the broader population in BC and whether and when booster doses might be needed.
Rob, do you have a follow-up?
I do, and my follow-up is on behalf of or for a colleague, and it's for Minister Dix. It relates to routine colonoscopies, and the question relates to a story she's doing about a 40-year-old mother who's advocating for routine colonoscopies in young adults to help with early diagnosis of colorectal cancer after this mother waited for more than a decade to get one, which ultimately diagnosed her with terminal cancer. She had no risk factors for colon cancer and thinks that a single colonoscopy much earlier would have spared this tragedy. So she's wondering, why isn't BC making colonoscopy screenings routine from a young age, similar to the system around pap smears?
Interesting. I have some thoughts on that.
Yeah, I think to a degree, some of those questions are best with Dr. Henry. We have a colon cancer screening system in BC. In general, the age we start screening is 50 plus, although depending on your family circumstances, true in my family as in others, where there's a history of colon cancer, that might be different. We've dramatically increased the number of colonoscopies we performed over the last 3 years, in keeping with the very significant investment we've made in all forms of diagnostic screening. And certainly the request and the expression of concern from your viewer is one we'll take a look at. But those decisions about how we provide care are provided on medical advice. Obviously, the circumstances you described are tragic. Everyone in BC, I think, knows people who are living and dealing with cancer. So we're going to continue to, and have done, is increase services, even in this period of pandemic compared to what it was prior to 2017, for colonoscopies and for other diagnostic processes, including our province-wide colorectal cancer screening program, which I've been an advocate for, as you know. So the short answer is we let the healthcare professionals provide the guidance on this, but this is an area where we've invested as a province considerable resources with significant benefit, because obviously earlier detection means a greater chance of survival. And I know that personally in my family, as people will know, and in other people's families, the difference that can make. So that's why these screening programs are put in place. That's why we're enhancing the number of colonoscopies. That's why we support cancer screening programs, such as the new cancer screening program for lung cancer, in order to provide the earliest possible detection so we can provide the best possible outcomes for people. It's a very tragic story. My heart goes out to that family, and obviously I would be happy to talk to your viewer about her concerns and about her experience as well.
For the next question, we go to Rob Brown, Dawson Creek Mirror.
Good afternoon. Thanks for taking the call today. Just circling back to some stats earlier in the presentation, 26 COVID patients moved to ICUs away from Northern Health, and they are, as noted, not vaccinated. Both the Minister and Health Minister and Dr. Henry talk about leadership and getting vaccinated right now if you're not in British Columbia, Canada, nay, the world. Up in Northern Health area, and certainly in the Peace region, we've had a couple mayors go on the record as saying they're pro-choice as it relates to the vaccine, and a handful of chambers also note some vaccination passports concerns. Either the minister or Dr. Henry, how do you respond to your call for leadership when we have community leaders in this area quite frankly doing the opposite and going on the record as being in opposition to your recommendations as the health experts of the province? And how does that work in your battle against shambolic vaccination rates in certain areas of the province like this one?
Yeah, I'll let the minister take most of this, but I just want to say I've had the privilege again of meeting with with many of the mayors and local elected representatives across the north, and they have been 100% supportive of the important role that they play in providing advice and guidance and leadership in their communities. And it is important for local people, despite some of the pushback that they get from some people in those communities. And in every community in BC, there are more people who are vaccinated than not. And that's by an increasingly greater margin. So we need to make sure that we're putting out that important, good information, that we're countering the misinformation and the disinformation that is making people sometimes afraid, and that we make it very what's the right word, that we're very explicit about choice is one thing, but choice has consequences. And when those choices you make are having effects on the rest of your community, then that has implications. And it means that you are restricted from doing certain things. And that's the point of the BC vaccine card. It's to show people, to remind people that the choices they make have impacts on others. And we're seeing that in the north now, particularly in the Peace region, where people have to be transferred, where people can't get the care that they need. So all of us need to stand up and make sure that people have the information they need to make the right choice.
Thank you for the question. I just say that there are 32 patients that have been transferred since we started to do this some weeks ago now. 26 of those patients are positive for COVID-19. 6 are in other circumstances, but were best to receive their care elsewhere. But what it meant for all 32 was being flown by air ambulance from their home communities. There are, I believe, 22 of them came to Vancouver Island, which is a long way from Vanderhoof and from Smithers and from Pouskoupi and from Dawson Creek and from Fort St. John and from Prince George. It's a long way. It's hard on them, it's hard on their families, it's hard on the healthcare workers. It has an impact on surgeries, of course, everywhere, including on Vancouver Island. I want to say this, though. I'm very proud that we're doing it. It's absolutely the thing we need to do, which is to support one another in difficult times. That our workers in Northern Health have been doing exceptional work under difficult circumstances. And people in our healthcare system around the province is responding to support the North, just as the North supported other parts of BC at other times in the pandemic. Northern Health, Northern Health and communities in Northern Health have, I think, been incredibly supportive. We are providing care to everybody, no matter what your circumstances and no matter what your vaccination status. But we are saying this, that the more people who are vaccinated, the better off we'll all be. And I think, and I would say this, that when you have a diagnosis for COVID-19, you need critical care, there is no choice anymore. And it's not a choice, it's a decision people are making. I'm also proud of our mayors in the North and our MLAs in the North. People such as Shirley Bond and Nathan Cullen and Jen Rice and Mike Bernier and Dan Davies, John Rustad, Coralie Oakes, our representatives and MLAs in the North have been unanimous and passionate in their efforts to support vaccination. I think this reflects an incredible degree of leadership at the provincial level, and our mayors as well. And I'll just cite particularly in the Northeast, Mayor Bumstead, Mayor Ackerman. Mayor Bumstead called me on Monday. We spoke on Monday about the importance of working together and working with businesses and how we can encourage and raise vaccination rates. And I think we're having some impact there. So I think our leaders in the North, in their vast majority, and by vast majority I mean 95, 96, 97%, have been incredibly supportive, and they're necessary, and they're making those efforts. And we need everyone to get involved. This isn't calling anybody out, but this is saying that right now in this pandemic, we need everyone to get vaccinated, and that's especially the case because of case counts in the North.
Rob, do you have a follow-up?
Both have mentioned, there's consequences for their choices, and Mr. Dix talked about the mayor of Dawson, and speaking to him on Monday, he was on video last week on the front lawn of City Hall advocating choice. Again, and again, the mayor of Pouskoupi specifically has called the minister a liar, saying ICUs are empty. How do you respond when you have leaders, even if they're at the provincial level responding positively, at the local level they are on the record as being pro-choice and not get vaccinated right now?
Well, I'd make a distinction between those statements. Mayor Bumstead has consistently supported vaccination. I've talked to him multiple times. We're working together to see vaccination rates increase in Dawson Creek. As you know, they're around 65 or 66%, which is below where they are, for example, in Fort St. John, and we hope that a sense of municipal competition will raise those higher. I mean, I just think, I just say that our healthcare workers deserve better than leaders suggesting that they're not dealing with what has been an unbelievable pressure in our ICUs from people sick with COVID-19. It is a very challenging time. Maybe talk to the healthcare workers on Vancouver Island who are treating people from the north, the healthcare workers in the north who are treating people in the north, the healthcare workers everywhere in BC. This is just something we have to do together, which is to get vaccinated. It's very straightforward. If you are not vaccinated, you are vulnerable to this pandemic right now. It is in great degree a pandemic of the unvaccinated right now. And we need everybody, everywhere, to do their part in that effort for themselves, for the ones they love, for the ones they don't know, for people in other regions. I think British Columbia has gone together to an extraordinary degree. And let's face it, 89% of adults, 88% overall are vaccinated. And that shows that that's an expression in real form. That's not a vote. That's not a survey. That's people getting vaccinated. And we need those numbers to increase. And even in a community such as Dawson Creek, which is at around 2/3 of people receive their first dose immunization, that's still 2/3, right? And so I think that we have a lot of support in the north. Our healthcare workers deserve better than people diminishing their work. They are working flat out to help people. And we have some of the best outcomes for people in critical care. But you know what would be better? Fewer people in critical care with COVID-19. You know how we deal with that? We get vaccinated. It's free, it's available, get it done.
We have time for one more question, and we go to Tanya Fletcher, CBC.
Yeah, Dr. Henry, recent data on the BC CDC website indicates that the vaccinated people who are dying of COVID are over the age of 60. You mentioned earlier that work is being done to determine whether First Nations communities should get booster shots. But what consideration is being given to booster shots for, say, all people over the age of 60, regardless of whether they live in long-term care or assisted living?
So it's the whole the whole spectrum of who needs a booster shot, who's going to most benefit from a booster shot, what is the best timing, what is the who's the most at risk. So it is looking at a whole number of different populations. So community dwelling elders as well. Are we seeing breakthrough? And the answer is not a lot yet, but we do need to pay attention to that. So these are all questions that I spent several hours this morning with my colleagues across the country talking about. There's a framework. The National Advisory Committee on Immunization is considering these in great detail, and my counterparts in the Council of Medical Officers of Health, Chief Medical Officers of Health, we're looking at these data that are coming from NACI. So it is about whether it's First Nations communities, whether it's healthcare workers who were immunized early on, and how long does the protection last? Do we need to have a booster dose? What about people who work in settings where they can pass it on to people who are more at risk? Community dwelling elders, people by age, and the general population. So there's a whole number of considerations that we need to go through, whether it's ethical, effectiveness, when is the best time for it. So those are all things that we are seized with and have been for the last few weeks, and we'll have more to say about that in the coming weeks. By the end of this month, we'll have more information and be able to talk about other populations, including people in the community.
Do you have a follow-up, Tanya?
Please, this is for Minister Dix, and if we could get an answer in French as well. This is on a different topic. A report from Human Rights Watch was published this morning, and it's very critical of the way the province handled the heat dome this summer and the deaths. The report says a strategy specifically about elderly and handicapped people is needed. So what's your response to this report, and what would the province do differently next time?
I think we responded at length. Dr. Sarah Henderson, Dr. Henry gave a detailed briefing of the findings of the BC CDC with respect to the heat dome. And not surprisingly, those findings showed that those people who are the most socially isolated, who are living alone, those people who are of lower income, were most at risk from these extreme heat conditions. The heat dome that we saw in that period that weekend was described by Dr. Henderson as a 1 in 1,000-year event. Well, now it's happened. We had a very serious heat event in 2009. 110 people in that event passed away, in addition to the normal deaths one would see in that period. The heat on this weekend was 5 degrees hotter than that. It was an event that could not have happened without climate change. And all of the steps we've taken to address inequality in our province, to address climate change in our province, to address social isolation in our province in the last number of years, and we're going to list a lot of them, mitigate that. But with what occurred in our communities in the heat dome, they weren't sufficient to deal with what was a very serious issue. So those are the facts of the matter. What has happened since then is that there's a comprehensive review by the BC coroner. There's a review, and you saw some of the preliminary findings from the BC Centre for Disease Control, who have worked on those questions. We've taken very strong action to address issues at the ambulance service, because we essentially saw twice as many 911 calls on a day than we see on average, and the most in history by a mile. On June the 28th, for example, we've taken specific efforts improving ambulance services in 24 rural communities, adding to personnel in 26 other rural and remote communities, adding additional personnel and ambulances and dispatchers to build up our ambulance service even more. And we'd already gone through the largest hiring of full-time ambulance paramedics in the history of BC. That's how you respond. We're responding on the capital side in long-term care, where we're seeing the addition of more cooling capacity in our long-term care sector, which is long needed, those significant investments to keep people safer. And we're going to work with everyone, because these issues in this time of climate change have to be dealt with. Climate change is a central issue of our time, and the heat dome occurred in the context of 2 other public health emergencies, and of course the emergency that was the wildfires this summer. It was a significant thing, and we have to respond to that by making further improvements. But the significant steps that have been taken already are there. We have to acknowledge, with 570 people of incremental people who passed away that weekend, and how gutting that is for individuals. I know some of those people. It is, personally, it is very, very hard for them and for families to accept what happens. And so we have to respond to that by saying it isn't a 1 in 1,000 event any longer. It's our current reality, and make ourselves more resilient. And we have to recommit ourselves to the efforts to address man-made climate change in our world, in our country, and in our province. Je dirais en français, que bien entendu, on a lu le rapport de Human Rights Watch aujourd'hui. Il est clair que les gens qui en souffrent le plus, que ce soit en mourant tragiquement dans ces circonstances, c'est des personnes qui sont isolées socialement, ou qui n'ont pas des revenus moins de moyens, qui vivent dans des circonstances de pauvreté. Et il faut continuer à nous battre contre l'inégalité dans notre société, contre le changement du climat, contre l'isolement social. Et c'est ce qu'on a fait, surtout pour des gens de 3e âge. Mais cela étant, des gens qui vivaient seuls, surtout leur appartement, surtout dans la région de Vancouver, ont souffert le plus. On est en train de prendre des actions, mais force est de reconnaître que c'est un défi pour notre société d'assurer que nous sommes même mieux préparés la prochaine fois. Parce que je pense maintenant, la prochaine fois est inévitable. Merci beaucoup. Thank you very much.